Myth number 1. Xanthelasma removal will cost thousands. There are many safe ways of removing xanthelasmas. The most expensive option is laser removal, and the least expensive is the use of custom formulated specialized peels. Both methods, most expensive and least expensive, are equally effective in removing xanthelasmas without scarring the patient. So you pay different amounts to achieve the same result. There are also other options in between by using alternative medical equipment. These options can be less expensive than using lasers, but equally effective. You can read additional information on our website on the matter. Removing xanthelasmas using lasers or other medical equipment is usually accomplished within one session. So once you have undergone the procedure, the job is done and you can go home. However, the safety and success rate of procedures involving the use of medical equipment is highly dependent on the ability of the operator. And it is mainly the ability of the operator what you're paying for, because sometimes it can take years of training to be able to safely perform cosmetic procedures by using specialized equipment. Also, xanthelasma is a rare condition affecting approximately 1% of the population. Therefore, professionals specializing in removing xanthelasmas using medical equipment can be rare and therefore expensive to find locally. As a consequence, removing xanthelasmas using professional equipment comes at a high premium. On the other hand, although it can take more than one session, removing xanthelasma using custom formulated peels leads to the same results as using lasers, Clarker, Hyfricator, or any other professional equipment. Myth number 2. You have to live with xanthelasma and cover it up. Fortunately, this is not true. You can have your xanthelasma removed without having any scars left at all, using many different methods. So today, removing your xanthelasmas is safe and you should not cover them up as a long-term fix. Myth number 3. Xanthelasmas are there because of high cholesterol levels. Amongst the people affected by xanthelasmas, there are many who have normal cholesterol levels. Also, it seems that high cholesterol incidence amongst xanthelasma sufferers is very similar to that of those who never develop xanthelasma. There is a published study which links the use of cholesterol-lowering drugs with the disappearance of xanthelasmas. This study is reporting one case only. There are not enough studies we could find to advise you on the use of cholesterol-lowering drugs to remove your xanthelasmas. Any cholesterol-lowering drug should be used if prescribed by your doctor. If you have xanthelasmas and high cholesterol, we advise you to lower your cholesterol by dietary and lifestyle change. Although reducing your cholesterol levels may or may not help remove your xanthelasmas, it is better to keep your cholesterol levels down in order to decrease your likelihood of heart disease. Myth number 4. No point on removing the xanthelasmas because they will be back. It is true that sometimes xanthelasmas will come back after removal. There would be little point in removing xanthelasmas if removal was extremely expensive or risky. But effective xanthelasma removal is neither expensive nor that risky. Myth number 5. If I have xanthelasmas, I am more likely to die younger of heart-related diseases. We are happy to tell you that may be not true. We believe that if you have xanthelasma and your cholesterol levels are normal, you are very likely to have the same life expectancy as anybody else. However, we believe that it is always a good idea to engage in vigorous physical exercise like cycling, jogging, playing football and other sports, just in case. Thank you for watching and please check out our website regularly for future updates.
只是童言无忌，天真岁月不忍欺，青春荒唐。